Sakra World Hospital, Bangalore. So we have with us Dr. Santhosh Bethur, Senior Consultant in Urology and Andrology. So to discuss all your questions on kidney stones. So I would like to give some view on our topic today.
Thank you for that introduction. I'm Dr. Santhosh Bethur. I'm working as a senior consultant in Sakra World Hospital. So today we choose this topic of kidney stones because it is a very common disease affecting any age group. Okay, most of the people will have these common questions whether kidney stones can be prevented, what are the ways we can treat the kidney stones, and why do we form stones, and is there any way we can prevent these stones. So all these are all common questions which most of us face in our clinical practice day to day. So I'll just try to explain most of these queries in our discussion in the next few minutes. I'll be very brief. I may not be able to explain everything in these videos, but I will try to explain in your own language. It's being a doctor, it is very difficult for me to explain in a common man's language. So, but again, I know you want to know in your own language. I'll try to be as brief as possible. I'll try to explain so that you can understand. And if you have any queries, you can always reach out to me. So we will share our contact information. If anyone is suffering from kidney stones, of course, we are happy to treat you. Yeah, that's it about some kidney stones, and he is going to ask some questions. I will try to explain the things in a clear mind.
Sure, sir. So here we have some questions from our viewers, sir, regarding on the kidney stones. So how common are kidney stones, sir?
So what they say is kidney stone is probably one of the most common disease affecting the humans. It is next only to infections. If you consider any infections like respiratory infection, viral infection as a one common disease, then probably the kidney stones comes as second or third in the incidence of kidney disease or incidence of any disease for that matter. So then some estimates say nearly 12% of world population at some point of their lifetime they will suffer from kidney stones. Again, we don't have an exact data in an Indian setup, but looking at our clinical practice, the patient load we see in a day, I see at least 3 to 4 kidney stones in my OPD clinic. It's quite common. Yeah. So,
do children get the kidney stones, sir?
Yes, as I explained, kidney stones are common it's common in adults. Not that common in children, but children also get. It can affect any age. The youngest patient I have seen is 1 year old. So it can affect any person of any age and any sex. So especially when kidney stone happen in children, so usually we try to see is there any underlying cause. We call it as they're born with some tendencies. These children, they are born with certain kidney disease or some metabolic abnormality, means there are some abnormalities in their blood where they will predispose these children to form stones. So most of the time whenever children come with stones, it is not just the stone we are treating. It's we have to treat the patient as a whole. In the sense, just removal of kidney stone is not sufficient. We have to see why this kid has formed the stone. So for example, there is something called medullary sponge kidney, or there is something called renal tubular acidosis. Basically what it means is the kids will have some underlying disease. Because of that reason they form. But in adults and other age group, the common reason is about the diet and their lifestyles. But in children, almost always it is because of some genetic nature.
So what are the symptoms of the kidney stones?
So kidney stone symptoms, I would say it can range from a silent stone where it will be a patient will be absolutely alright. They will notice these kidney stones when they do scans for some other reason. Let's say they do a general health checkup or they do scans for some other abdominal pain. Then they can notice these stones as an incidental finding, or they can present with the most common symptom is pain. So the pain can vary, it can be very mild or it can be as intense as I would say on a scale of 1 to 10, it will be 9. Okay, some people they say the severity of pain is next only to the labor pain one can experience. So the pain is the common symptom, and apart from that, depending upon the location of stone. See, if you can go and Google search the anatomy of urinary tract, the symptoms depends on the location of stone. If there is a stone in the kidney, you can have pain in your flanks, on your sides, in these region. So it can be very mild, some discomfort or vague discomfort, or can be intense pain if the stone is stuck in the tube. People can have associated vomiting, they can present with infections because of the stone blocking the kidneys, they can have fever, they will see sometimes blood in the urine. These are all sudden presentations. I mean, apparently the person is all right, and suddenly one day he experiences pain and he has to seek treatment. Suppose somebody is having stones for a very long time, or they are having very big stones, eventually it will affect the kidney function. Let's say there is a stone blocking one of the kidneys. So we have inbuilt mechanism in our own bodies where our body will try to protect itself. Now kidney also has its own mechanism. Initially what it try to do is it will try to produce more urine and try to push the stone out. But again it will get tired over a period of time. It cannot do the same thing over and over again. So what it will do is it will shut down its urine production temporarily, so that the pain is reduced. So that is the reason sometimes patients will get intense pain and suddenly it disappears. But if it is neglected, whatever the function is affected to the kidney, if you remove the stone or treat the stone, it will recover. But if the obstruction is there for more than 3-4 weeks and we are not treating these stones, whatever the kidney damage it causes, it is permanent. See, unlike let's say we have a skin, okay? If there is an injury to skin, what will happen is our body will regenerate another skin, another layer of skin will develop. But kidney is one of those cells where if there is a damage, there will be no regeneration. Whatever the damage has happened, it's a permanent damage. So if it is neglected, it can damage the kidneys. And if the stone is on both the sides, people can present with kidney failures. Yes. So to summarize, they can present with a simple pain or even symptoms of renal failure. It depends upon for how long the patient is having the stones.
Definitely. So, are there any long-term consequences with the kidney stone?
Yeah. So as we just discussed now, the long-term consequence is the renal failure or the kidney failure. So all the things what we are doing is to protect the kidneys from the damage from happening. Okay. So whenever somebody is presenting to us in our clinic, depends, like let's say he's having pain for 1 day. Usually those kidneys are recoverable. Okay, so whenever we treat those stones, most of the kidney function will recover. But suppose somebody is having stones and pain for last 2 to 3 years or something like that, so the damage can be permanent. So the long-term consequence is damage to the kidneys which cannot recover. If the damage happen on both the sides, see, we know that we have both 2 kidneys. If even if one kidney is affected, the other kidney will compensate for the opposite kidney's damage, and we can still live a normal life. Suppose if you have stone on both the sides, the long-term consequence is renal failure, and if kidney is already damaged, the person will end up having dialysis regularly, or he may require renal transplant also, or kidney transplant.
So, how do I treat my kidney stones?
So again, it comes to a point that it depends on the type of stones. Type of stones in the sense, basically size of stone. If stones are small, let's say they are based on number of studies which published in medical journals. Any stone less than 5 mm is considered as small. Small in the sense they will pass with medications. So most commonly what we do is we'll ask the patient to drink a lot of water, and we'll give them some painkillers to tide over the pain, and there are some medications which will help in passing the stone. So usually we keep a limit of 5 mm. Not that it cannot pass after 5 mm, but the chances are less. Now let's say somebody is there with you can ask me what about 5.5 mm. It's not hard and fast rule, but then what we generally suggest is if it is small, it will pass. Beyond 5 mm, the chances are significantly less. Now let's say it's a 7 mm. Usually we will not wait, because let's say somebody is having a chance of passing the stone with medications is like 2 or 3%. Will you take that chance? Okay, so it's a big chance you are going to take, no? So when the risk is damage to the kidneys, nobody wants to take that chance. If I say, yeah, 5 millimeter, you don't worry, you go home, you can try some medications. Yes, of course, it makes sense to take the chance. But again, 1 centimeter, 2 centimeter, and most of time they will ask the one question: how soon we have to get the treatment done? It's just a simple common sense thing. The moment we diagnose, as soon as possible is the best time to treat the stones.
So what are the treatments options available?
Yes, so there are plenty of options, as I mentioned now, with the simple medications and what people commonly call as flush therapy. Flush therapy is essentially we force our kidney to produce more urine so that it will like flush the stone out of the system. That we can do with by admitting the patient and giving IV fluids if somebody is not able to consume too much of water, because sometimes kidney stone patients, it's not just about the pain. He is having a continuous pain associated with vomiting. If somebody is having vomiting, we cannot ask him to drink water or just too much of fluids. So in those cases, we admit for giving IV fluids. If somebody can consume good amount of water and can manage at home, we send them home with the painkillers. And with water therapy, most of the time they will pass these stones. Now, once we decide that these stones we will not be able to treat them with the medications, there are plenty of options. So most commonly we do treat them with the help of an endoscope. Okay, so we call it as endoscopic treatment. Endoscopic treatment typically involves admitting the patient for a day in the hospital. There are a lot of miniature instruments. We have got long rigid instruments. Rigid instrument in the sense it cannot bend. So we can treat a smaller stones in the lower part of the urinary tract, like in the bladder and the lower part of the ureter. So we can use these instruments to treat the stone. So what we essentially do is, there are no cuts involved. Basically, we go through the natural passage. So we have got to see if, like, let's say somebody wants to see the stomach. So they will pass an endoscope through the mouth. So now for our urinary tract, we go through the urethra, and from below we can go up to the kidneys. We have got specialized equipments, miniature instruments. So we go through the existing passage. Once we reach the stone, so we have got different energy sources. Means we cannot just pull out the stone. As I said, smaller stone do pass. The bigger stone we cannot pull it out like that. It will, unless we without damaging our organs. So what we do essentially is we use laser, and there is something called volmium laser, there is something called thulmium laser. With the help of a laser, we will break these stones into tiny bits and remove one by one. Or sometimes what we do is we will make it into fine powder. So all this powder will flush out in the urine. So that is one of the most common surgeries performed in our setup. And there is, suppose sometimes stones are very big, let's say like 4 or 5 centimeter stone. Even these stones can be treated with endoscopy, and with the present generation of lasers, we can easily treat them. Once in a while, we have to puncture the kidney to remove these stones. So from the back, we create a track into the kidney directly. We go inside the track and remove the stone again by breaking them into pieces. Also, there is an option of something called lithotripsy. So in conventional practice, what I see is most of the people ask whether the laser therapy is available. So laser therapy in a truest sense, in strict sense, is what I explained. So without doing an endoscopy, I cannot use the laser. But for the common man, what they mean by laser surgery is treating these stones without any surgery. So basically, it is shockwave therapy. So what they do is they will pass the shock waves. Shock waves are essentially sound waves. Okay, so they are specialized. They are created in certain way. They will pass through your body without damaging your organs, and they will concentrate all these waves on the stone inside the kidney, and these stones will be broken into pieces. Okay, then they will pass through the urine. So like 1 centimeter stone cannot pass on its own. When we break them into tiny pieces, they will pass. This is also one of the option. Again, which modality is required is very individualized. It depends on patient to patient, depending upon how soon we have to treat, and age of the patient. Whether suppose somebody is very old and is not fit for any procedure, So we do these shockwave therapies. And if somebody is again children we don't have enough. Yeah, we do have miniature instruments, but still the children have a smaller organs. It is difficult to treat these stones with these endoscopies, so we use these shock waves. So it depends on the patient.
So how kidney stones will form, and what are the risk factors of the kidney stone of formation?
So again, most common reason in our practice what we see is inadequate water intake. Somebody is not consuming adequate water. See, for normal day-to-day our body function, we require around 2 liters of water per day. Let's say considering all weather and weather conditions and all, in a place like Bangalore where it is relatively cooler. So in a normal weather, in a winter or rainy season, I would say around 2 to 2.5 liters. Let's say we are talking in summer now. They will need extra another liter of water, right? Let's say 3 to 4 liters of water daily. So if somebody is not drinking enough water, that's the most common risk factor for forming the stone. And why we form is, it's very simple chemistry. You take a glass of water, you keep adding salt. Initially it will dissolve. You keep doing that, keep on adding the salt. Keep the water level same. So at certain point of time it won't dissolve. So it's something called simple saturation, we all read in chemistry. If you keep on adding the salt, after a certain point it won't dissolve, it will crystallize. So exactly same thing happens in our urine. When our urine is produced in our body, you keep on adding water, even though there is a risk factor for forming a stone, let's say, but if the water quantity is more, so it will dissolve these salts and pass them in urine. So the moment you reduce the water intake, that's the most common risk factor. Again, some diets, the most common thing we say is we Indians are fond of eating salt. Okay, so unlike Westerners where they don't put salt to any of their cooking things, we eat lot of salt. So per day the requirement of salt for us is, in generally they say, is 5 gram. 5 gram is just a small spoon, not even a teaspoon, I think. It's smaller than that. 5 gram in an entire day. Probably we will be eating 2 or 3 times of that quantity in a day. So the salt intake is a risk factor. Somebody is eating red meat, especially non-vegetarian in the sense red meat. Okay, so that is also high protein diet basically.
So proteins.
Yes, too much of proteins in your food. Whether it is even the vegetarian, means a lot of people are now going into gym and all. So one of the things we are seeing is commonly they come with a question that whether I can take supplementary protein. See, of course, for somebody is building their body and their protein requirement is more. In generally, for a normal person, the protein requirement in an adult is 1 gram per day. Let's say now you are 70 or 80 kg. You will require 80 kg of protein, 80 gram of protein per day. Now, if you consume like 100 grams, 200 grams, I've seen people eating like 4 or 5 eggs in a day. 3 times non-vegetarian diet, and again there is something called whey protein, commercial preparations of protein. So these are all quite high risk for forming stones. Again, there are some genetic factors. I mean, this is a big thing. For in generally, this is something which you cannot change. These are the things you can change. So simple diet and all. Again, genetic factors. Whenever you meet a doctor, they will do certain blood tests and urine tests to see if there is any underlying cause. So thereafter, if they identify any particular cause, they will treat that.
Definitely, sir. So how can I decrease my risk factor having a kidney stone, sir?
So again, water. So water in either a pure form or any fluids, whether you're fond of drinking tender coconut, any fruit juice, or you want to take buttermilk, whatever it is. So you consume more fluids. So if water quantity is more in your body, the chances are very less. Again, certain factors which will prevent the stone formation, there is something called citrates. Citrates are basically lime, lemon, sweet lime, oranges, they all contain citrates. Citrates protect against forming stone. So you can consume more lemon juice, sweet lime, oranges, they all help in preventing the stone. Apart from that, certain diets, I mean, we commonly see is the common questions is any vegetables with seeds. See, any food you're eating in moderate quantity is good. Anything excess is bad for your health. Let's say palak. Palak is high in oxalates. Also, oxalate is one of the common stones. It's usually formed by high concentration of oxalate in the urine, it will combine with calcium and form calcium oxalate. So to reduce the oxalate, we say reduce the quantity of oxalate in your food. So nowadays diet and all, it's easy to find out. You can just Google the types of stones and what are the diet you need to do. There are hundreds of things, but again you cannot stop eating everything. So eat in moderation, drink good amount of water, reduce salt intake in your food, and adequate protein intake. Not less, not more.
So as such, one curiosity questions around my side. So is there any genetic kind of thing to, like, generations has been like if father got this stone and some pass on kind of thing, sir?
There is no definite, now let's say you ask, is there any particular gene where we can identify that somebody will form a stone? There's no particular gene is identified. It is what we call it as multifactorial. Multifactor in the sense, yes, you will have some genetic abnormality, but that's not the only thing that will predispose someone for the stone formation. See, now you asked one question that somebody is for parents having stones and somebody's grandparents. Yeah, they may have some genetic component. Also, the common thing is, see, they are all eating in the same household.
Same house.
Okay, so their food habits are also same.
Common diet they are following.
Yes, their food habit is same. Their general cultural behavior with respect to water intake or food consumption is same. That may be one of the reasons for forming stone in a family. Okay, so but yes, of course, there is some genetic predisposition to it.
With this, we come up to an end as live today. So thank you, doctor, your valuable time and valuable inputs from us. Thank you for the viewers for joining with us. If you have any queries, you can leave a comment and our experts will answer them for you. Thank you.
Thank you. ಎಷ್ಟು ನಿಮಿಷ ಆಯ್ತಾ? ಜಾಸ್ತಿನೇ ಆಗೋಯ್ತಲ್ಲ 20 ನಿಮಿಷ.